Good morning, everybody, and welcome to another session of SACPA. During this time of social and physical distancing, SACPA believes it's important to keep engaging with the public on issues of the day, and in order to do so, we are very thankful for the continued support we receive from the University of Lethbridge, Shaw Spotlight, and the Lethbridge Herald. Today we have Sandra Azokar, the Executive Director of Friends of Medicare, joining us from Edmonton on the topic of healthcare in crisis, COVID-19 and beyond. Sandra has been a social activist for more than 30 years in Alberta. Her previous experience is working as a child protection worker, a community organizer, and a labor activist. Prior to coming to the Friends of Medicare, she served as the Vice President of the Alberta Union of Provincial Employees. She was a member of the Board of Directors of Friends of Medicare for 6 years before becoming the Executive Director in 2012. I want to thank you very much, Sandra, for joining us today, and we look forward to your talk.
Thank you so much for that introduction, and good morning. Thank you to SACPA for allowing me to bring greetings from Friends of Medicare today. Our organization, if you could just show quickly our first slide there, our organization was founded in 1979 as a nonpartisan advocacy society, and it has since that time been lobbying and advocating for the protection and expansion of our publicly funded, publicly administered, and publicly delivered health care. We're a coalition of many individuals and organizations, including physicians and patients, seniors organizations, cultural, faith, and community groups, as well as labor organizations. We're nonpartisan, but we understand the importance of politics and ideology, which is only bad when you don't agree with it. We get called a special interest group quite often lately, but I can tell you that the special interest that we have and what guides our work is in the improvement and expansion of a public healthcare system that is there based on need and not ability to pay. The ideology that drives us is one that is based on the central tenet of equity, because at the end of the day, if we can't be equal when we're sick, at the time when we're the most vulnerable, then when can we be equal? We're all the same. We're all from the part of the human race. We believe that governing is about choices. Can you put next slide, please? About the political will to impact change, guided and based on the values that are held by those in leadership positions. In April of 2019, we elected a government who, if anything, has been very clear with Albertans about their intentions and of their plans for Alberta's public services. So far, we have seen that they celebrate, sorry. This is my page just died there. They celebrate individualism and that they want to see us move away from that collectivism that embodies the caring and compassion that is necessary to advance society. And finally, they have repeatedly shown an endless quest to privatize. As Albertans continue to navigate one of the worst health crises that we have experienced in decades, we find ourselves in an unprecedented political time. After years of the same political playbook, which is currently being used in Alberta, it has been our experience that their actions and policy setting is by design and not by accident. This government will under-resource, underfund, and understaff our public services, our public health care, and offer the private sector as a solution. Given that I only have 30 minutes, I'm going to highlight a few of the areas that we have been focusing on in our advocacy and attempt to kind of show a bit of a pattern of what it is that I described initially. So as COVID continues to impact our day-to-day reality, many of us have been reflecting on the vital importance of our public healthcare system. As we look around the world and various countries' responses to this unprecedented pandemic, it has become especially timely that we fortify our commitment to a system based not on profit, but instead on the shared belief that healthcare is a human right. But unfortunately, in this province, during one of the worst health crises we have ever faced, our government has doubled down on their efforts to undermine and erode our public health care. Instead of seeing greater support for our healthcare system and the workers who keep it going, we are seeing this crisis being leveraged to usher in legislations and initiatives that pave the way for ever more privatization of our healthcare. This pandemic has served as a grim testament to the necessity of Canada's universal public healthcare system, and it has illuminated those areas of our healthcare that are in dire need of improvement. So let's set the stage. Next slide, please. In May of 2019, the UCP appointed Janice McKinnon to chair the Blue Ribbon Panel and to look into the province's expenditures. The panel was given a very narrow mandate to examine expenses, but not revenues, and was tasked with recommending a path to a balanced budget by the year 2022-23 without raising taxes. The panel released its report on September 3rd, and the recommendations included massive cuts to public services, which served to directly inform the UCP future policies and financial planning. In the area of healthcare, the panel recommended transformational changes in the way that healthcare services are delivered and healthcare professionals are compensated. Most concerning was the recommendation that the government expand the role of private healthcare in Alberta. We propose that this transformational change should have focused on expanding and improving our public healthcare system rather than looking at expanding the role of private healthcare. If we were serious about transformational change, we need to look at bringing back under the public umbrella all those areas in our healthcare that have been heavily privatized in this province, such as seniors care and home care, which I will be touching on briefly later on in this presentation. The recommendation that Alberta look at the use of alternative services delivery for day procedures and other services that do not have to be delivered in hospitals, that could be delivered in private or not-for-profit facility, was and it's still the wrong and irresponsible direction to take in dealing with our wait times and dealing with some of the backlogs that we have seen over the years when it comes to surgeries. One of the basic problems among the many with private healthcare is that entrepreneurs charge whatever the market will bear. It's all about chasing a few customers who are willing to pay a lot more for even a little extra. Private healthcare maximizes price and cost as well as waste, so it systematically erodes global cost control, which is one of the essential strengths of any public health system. The government becomes, as a result, the primary customer in this private for-profit world. Move forward to February 2020. The government released a $2 million Ernest Young review of health services that had a focus on economics and finding efficiencies in our healthcare system. This report contained 57 recommendations that by their estimate could result in an estimated 1.9 billion savings. Though the health minister Sandra indicated at that time that all not recommendations were feasible or would be implemented. The initial plan was to have all these implementations in place by August 13th, and of course, given that we have lived through a pandemic, those implementations are still not out formally, but yet we're seeing slowly how some of these recommendations are playing out in the healthcare system. This report basically served to provide an ideological fodder for this government to start the process of privatizing our healthcare system by contracting out and reducing healthcare services available to Albertans. The recommendations outlined in this report ultimately had the potential to turn over resources, healthcare dollars, and staff to private companies that will be subsidized by public healthcare dollars rather than building upon the solid foundation that we have in our healthcare. Between the release of the McKinnon report and Ernest Young Alberta Health Services, the government had forecasted a potential of 5,000 healthcare jobs losses. Can you show the next couple of slides? I should have asked you to put those through while we were doing this. Um, with these reports in hand, um, the world and Albertan gets hit by a pandemic, and the economy hits rock bottom and comes to a full stop in March. At the start of this pandemic, the government pushed through Budget 2020, which was based on an unrealistic forecast for oil prices and some subsequent government revenues. Put that together with the economic impact that this pandemic will have on all Canadians, it was very clear that what this government needed to do was to push the reset button and to go back to the drawing board for Budget 2020. But we didn't see any of that happening. Yet we saw a quarterly update that had, instead of going forward, a very much clear indication that our province financially is going to be in a serious crisis that will require us to make, take into consideration some of the priorities that will lead the way that Albertans receive healthcare and public services going forward. In the middle of this pandemic, though, we saw a never-ending narrative about bringing in private surgical facilities to address wait times, for the government to bring in the surgical initiative, the Alberta Surgical Initiative, that has been touted as the savior for our healthcare system. And for that, they needed to start passing legislation that would allow them to do that. So one of the bills that actually impacts some of that work that the government is currently bent on putting forward was the passing of Bill 30, which is the Health Statutes Amendment Act. And with that bill, Alberta is on track to the creation of market entry for private health care. This omnibus bill made sweeping changes to Albertans' healthcare, including repealing or changing 9 pieces of existing health legislation. It provided the legislative framework for the privatization of our healthcare. The changes contained in this bill have the potential to turn over our resources, healthcare dollars, and staff to private corporations. The bill follows several of the recommendations in the performance review of the Alberta Health Services. As we know, that was contracted by Ernest Young, as I've mentioned before. Some highlights of this Bill 30 include the fact that the Healthcare Protection Act would be renamed to the Health Facility Act and would lower the bar for the approval of new private clinics and private surgical facilities. If you remember, if you're old enough to remember or young enough to remember, the current Healthcare Protection Act, formerly known as the infamous Bill 11, resulted from hundreds of thousands of Albertans standing up and protesting against the then Premier Klein's ongoing attempt to establish a parallel private healthcare system in Alberta. So we didn't win that fight, but what we did win was the protection that was afforded to our public healthcare system under that bill that basically disallowed some of the things that will be allowed under this new bill. As well, one of the things that we're going to be seeing in this bill, under the guise of choice, non-physician corporations would be able to employ doctors. Corporations whose ultimate goal is to profit. This type of change in the employer relationship, right now physicians are employed by the government, and now we've opened it up for corporations to come in and basically bill the government as a third party and hire physicians who will no longer be able to if they work for these corporations, to bill directly to Alberta Health Services for their services. So that's a huge concern that we have. It's taking that public administration away from physicians and from our public healthcare system and turning these corporations into the employer. The other thing that was notable from this bill is the number of public members appointed by the ministers to sit on regulatory colleges would be doubled, enabling the government to stack councils with their supporters, as we have seen with other types of boards that have been stacked with individuals that make it much easier for this government to push forward their agenda. Overall, this bill is a very damaging piece of legislation intended to erode public delivery of healthcare by building a healthcare delivery market and encouraging much greater corporate involvement by allowing them to receive public funding for publicly funded services. And that's how we actually have been sold this new bill, is by saying that Albertans won't pay anything out of pocket because it's publicly funded. But the intent of it is the fact that we are actually setting the stage for potential significant shift to for-profit delivery of not only surgical surgeries, but also of acute care, diagnostic imaging, labs, and primary community care services. If you can put the next slide up. Um, Shortly after this bill was passed, we saw that this government is looking to establish a health contracting secretariat, whose role will be focused on building the healthcare delivery market and reducing barriers to market entry for larger corporate players. Highlights from this request for proposal that lasted for a month indicated clearly that this secretary would be used to build internal markets, next slide please, for outsourcing surgeries and imaging, and getting public and private sector to compete on price per procedure, purchase providers, etc., and entrenching private sector actors into our current public health care. The end game here is to force public health authorities to compete on prices with the for-profit facilities, and where you are often not comparing apples to apples. It's not a good game to get into when we are contracting out our healthcare services to large corporations. It sets the stage for the fear that we have had for a long time. Alberta has always been seen as a fertile ground for private interests, and now with this bill and with the subsequent steps that have been taking, we are seeing that this fertile ground has been potentially open to the market system. So Premier Kenney wasn't kidding when he said that Alberta was open for business. Basically, this business also includes healthcare. Two issues here that need to be highlighted as we see this contracting out of our surgeries to private corporations is that in order for them to be successful, the volumes guaranteed to bring these players into the market will have to likely stay there post-COVID. And contracting out of the simple stuff, which is what normally happens when we have these types of arrangements, will only serve to throw off the case mix in public hospitals. And the ministries often realize very quickly that there's only so many day procedures of low acuity and less complex patients they can send to the non-hospital surgical facilities, and they will need to allow eventually more complex surgeries and higher acuity in order to guarantee sufficient volumes to encourage these players or these investors to enter the market. And that's what the profits will tell government. Alberta wants about 30% of surgical volume provincially contracted out, up from about 15%. So for a government that has spoken nonstop about the high cost of providing health care, about the sustainability of our health care if we don't control costs, about how we need to lower the cost of providing health care, about fiscal restraint, et cetera, ironically, we're seeing the reverse. We're seeing very ironic that we're seeing as something completely removed from that narrative that we keep on hearing. What we're not hearing is what is not being shared with Albertans is how much contracting out our public health care will ultimately cost to the citizens of this province, nor any comparators of how much it would cost to instead increase in hospital capacity or build public infrastructure in the interest of the public good. So I think that's, if anything, that lesson, if you hear anything from my presentation, is that we need to start demanding that accountability from this government, who talks a good talk, but yet their actions when it comes to contracting out is not indicative of them going through with this need to save us money. So now that we have the legislative framework for this privatization to start taking shape, we're starting to see those who seek to profit from our healthcare start to come forward. So through a story that was just released by CBC in August, we learned about the lengths that this government will go in order to push their privatization agenda on Albertans. A new private orthopedic surgical facility, the largest ever in Alberta, has been proposed on the site of the Erickson Neeson car lot here in Edmonton, which is next to the Royal Alex Hospital. And basically through the tentative political support. So this was 5 orthopedic surgeons, the principal advisor for the Minister of Health, lobbyists and representatives from Erickson Neeson that all came together, hired an architect, and had ongoing ready access to the Minister of Health. And so for us, this deal shows unequivocally how ideologically driven healthcare delivery objectives are mixing with political influence and interference in this province. Behind closed doors, away from any public accountability, scrutiny, or oversight, the Minister of Health has given ready access to those who seek to profit from the poor health of Albertans. Under the proposed term of this backroom deal, the 200 plus million 5 to 7-story private surgical facility would be tasked with performing all insured minor surgeries, while the public system would be left with the more complex cases, as I mentioned before, which is what they need to do to make this an attractive market deal. This deal ensured that the government, meaning every single Albertan, would assume all risk if the privatization experiment did not work out. Albertans must remember now that when the same type of business model was tried at the Health Resource Center in Calgary, they very quickly went bankrupt, leaving Albertans on the hook for millions of dollars and over 900 surgeries that had to be brought back under the public system. Those leading the projects for the new private facility intended to make the contract so tight that if any other government is elected, it would be prohibitively expensive for them to cancel it. So they also proposed that they would be saving money by hiring non-unionized staff, creating a risk of underpaid and overworked staff and poorer health outcomes for patients. So government ideologues insist that contracting out is benign because services are still paid for with public money, as I mentioned before. But this is far from truth. Contracting out surgical facilities is more accurately described as corporate subsidies, and it is about the most nonsensical way to make use of public money that you can think of if you tried. Past attempts to privatize surgeries in this province and across Canada have shown that private delivery of surgical facilities costs more than public delivery. Contracting out means that the public lose our right to see what we're paying for, services from private suppliers, and are denied any input on how to provide or change services. This project is not about shortening wait lists. Contracting out is not about this Alberta surgical initiative is not about shortening wait lists either, providing better care or improving the healthcare system. It is about the privatization of our healthcare. Systemic changes are needed to address Alberta's health care issues, but they must be in line with the vision of improving on the solid foundation that we already have within our public system and improving our existing public capacity. Unfortunately, as we have seen, that this government is not interested in funding public solutions because that would mean that the government would have to truly believe in the value of public health care. On a smaller scale, but worth mentioning, is this Bill 204 that was introduced on July the 8th by MLA Tanny Yao from Fort McMurray. Bill 204 was called the Voluntary Blood Donation Repeal Act. And this very work-shy, mere 3-page bill simply called for the repeal of the Voluntary Blood Donation Act that was passed in 2017. And it offered no alternative to address our current dependency on the U.S. plasma-derived products, and no reason to necessitate this repeal except for to further this government's never-ending quest to privatize our public resources. To some degree, I'm glad that the session ended when it did, because this bill was left on the books. But MLA Yao has made it clear that he intends to bring it back. Just very worthy of note, during the discussion in the committee that deals with these private members bill, we had the opportunity to listen to Dr. who is the head of the Canadian Blood Services, our national collector of blood, and he made it very clear that introducing or repealing this act would impact our blood supply, negatively impact our blood supply, and that he couldn't support this bill. So, you know, after hearing directly from our national blood collector, it stands to reason that they would not pursue this, but that remains to be seen. And now we move to public labs, public laboratories who have been in the media quite often since the beginning of this pandemic. As one of the first moves as government, prior to even before being sworn in, the UCP announced that the $590 million lab hub project would be put on hold until they had an opportunity to review the project. Then soon after this announcement, can you put the next slide, please? Premier-elect Jason Kenney claimed that the project will do nothing to improve patient services, a claim which is both inaccurate and disrespectful to laboratory workers and the vital work that they do for Albertans. During that time, there was quite a few reports that showed that our current lab system as it is outdated and overwrought, and that without a plan in its stead, this halt to what was to be a major expansion of our public lab service puts Albertans' health in jeopardy. Next slide. There was subsequent news reports. Albertans learned that physicians had been instructed to buy a new equipment that couldn't be moved or would be expensive to move to the new facility. But while politicians and government agencies play the blame game, Albertans are still waiting to hear how and when this important services will be delivered. Quickly in October 2019, existing leadership in Alberta Public Labs was suddenly removed and the name changed to Alberta Precision Labs. And the name change was the removal of the word public, signal the inevitable move towards privatization. We know that prior to Alberta's COVID-19 outbreak, the government had already sent out a request for proposal, and we were all well on our way to putting this integral part of our healthcare up for grabs to the highest bidder. Next slide, please. If anything, COVID has shone a light on the importance of Alberta's public medical lab services. To date, Alberta's labs have administered nearly 1,062,956 tests on 832,000 Albertans, and that's far exceeding the number of tests administered per capita than any other jurisdiction in Canada. So basically now more than ever, Albertans are witnessing firsthand the direct link between the lab and their health. In Alberta, this pandemic has shone a light on the impact that having publicly delivered and funded lab services has made in helping to flatten the curve by providing the capacity for timely and effective diagnosis for those impacted by COVID. I have 5 minutes left, and I have to talk about seniors care, which is another area that we have actually seen under serious crisis during this pandemic. As of September 9th, out of the 248 COVID-19 related deaths, 162 have been facility residents. And after decades of us advocating and sounding the alarm around the issues facing seniors care, we continue to see the fact that the current funding structure that creates incentives for both not-for-profit and especially for-profit providers to pursue low-wage strategies for their staff um, has been I think has played a major role in the fact that we are not able to provide seniors with the kind of care that they need. Next slide, please. We saw these recommendations in the Ernest Young that the government needed to pursue further privatization. Next slide. That they wanted to see the sale of Care West and Capital Care to private providers as a one-time revenue source. And and those are the two last big, huge public seniors care facilities. They also wanted to see further privatization of continuing care by converting long-term care beds into designated supported living beds. In other words, reassess those individuals needing 24 hours care for unscheduled medical needs to lower levels of care, which is equally just as nefarious. Somehow we're going to make everybody better. This change would mean that residents would be considered to have lower staffing needs and would remove registered nursing from seniors care. Staffing has been long overlooked issue in continuing care. And so we continue to see it is beyond our comprehension as to why this government refuses to learn from the ongoing public health emergency that is COVID-19, despite glaring light it has cast onto the long existing cracks and weaknesses in our seniors care system. So hopefully you'll ask me a lot of questions around that area. We have, of course, the ongoing battle with the doctors as well that we need to address. And that started with the introduction and the passing of Bill 21, the Ensuring Fiscal Sustainability Act. That basically unilaterally ripped up the agreement for doctors. And next slide. And now we're seeing as a result of all these changes and the 11 recommendations that were made in this bill, with this bill, the passing of this bill, that we're seeing doctors flee our province and with a targeted attack against physicians providing primary care, our government has decided to make use of this health crisis to tout a corporate relationship with TELUS virtual care platform. There's lingering questions regarding the data and privacy compliance of this platform, which was created by a third party and which now has access to our healthcare information through NetCare. Patients without good comprehensive primary care will ultimately be forced to higher cost areas of our healthcare system, such as the emergency departments and admissions to hospital. So this entire very public negotiations with doctors is creating stress and uncertainty for those that rely on our healthcare system. In conclusion, this is not the first healthcare crisis that Alberta has seen and will not be the last. Now we have the responsibility to ensure that once the dust of this healthcare crisis has settled, our vital public healthcare system is not left to be squandered or privatized. Rather than seeking out short-term solutions in the interest of fiscal balance, our government must instead learn the difficult lesson of this pandemic and commit to putting the interests of Albertans first. At this time, when our province will be having to make critical financial decisions, Albertans are looking for real leadership and a real commitment to our public health care. Once we emerge from this pandemic, the political will to expand our public health will be more crucial than ever. Profit has no place in health care. Thank you.
Thank you very much for your presentation, Sandra. We've got quite a few questions. In But we have room for more, so folks, please go ahead and put your questions in. I will start with a question from Timothy, who's from the Lethbridge Herald, a reporter at the Lethbridge Herald. Many Albertans I talk to about this issue say they don't necessarily care how healthcare is delivered as long as the bill isn't sent to them at the end of the day. How do you answer that?
That's a great question, because basically that's the narrative that this government is using to sell the contracting out of surgical facilities. We in a way, when we're sick and we want the service and we need the service, you're right, it doesn't matter where you go. However, if we think outside of that immediacy to get the help, we also need to think long term when it comes to healthcare, and we need to think what kind of system we're helping to create, that will ultimately turn into, or could have the potential to turn into, a for-profit system, where if I or somebody else who has more money than I wants to get in quicker, it opens up the possibilities of queue jumping. It offers up the possibility of that inequity that is created when we introduce profit, when we introduce the medical entrepreneur model into this situation. So, the immediacy is there. Certainly, I don't blame anybody that needs the help and they need it now. But what we should be focusing in is not bringing in private solutions, but rather focusing on expanding our capacity within our public system, so that people don't have to wait, so that people don't have to be in a situation where they have to pay out of pocket for any type of health care.
Okay, thank you. Our next question comes from Ian Hurdle. I certainly agree with you on most aspects, especially after COVID experience in long-term care, so do not feel pressured by my questions. Is there room for a small percentage of private that puts pressure on rigid government systems to get better? Arguably, the initial Dr. Gimbal Clinic changed cataracts care for the world.
Yeah, and that's always been a question. I think in the way that we take care of seniors is a much broader explanation, I guess, if anything, because the continuing care system includes everything from you just needing a home where somebody comes in to checks to make that you woke up that morning, to home care. So we have various levels of care, and it needs to be separated from basically just providing a roof over somebody's head. And so that's, there is the whole idea that seniors can choose to go into different models of care. But what we're saying is that the privatization of seniors care in this province has created it went from providing health care, to a hospitality industry, to now a real estate industry, where people are coming and buying real estate back and forth, and outsourcing the staffing, outsourcing all kinds of things, with public money. So we have these private for-profit facilities. They charge whatever the market will bear. I heard from a resident, and I will name them because it's a public letter that I received, of a Chartwell increasing the rent by 200, and this couple was paying 4,600 for a one-room suite. So, like, I guess for us is again, is that long-term vision of what it is that we want to see, or what we're seeing right now, and how can we impact. Competition doesn't help in that way. Competition basically just allows those that have to be able to get better access to nicer things. But when it comes to all of us having the same access to the needed services, that's where that equity conversation needs to come in. There's no room for that type of competition. Choice is only good for you when you have the money to pay. So in that sense, what we have seen in the gimbal eye surgery thing as well, that Alberta, sorry, Edmonton has the majority, actually almost 100% of the cataract surgeries that are done here in Edmonton are done in the public system, whereas in Calgary the majority of them are done in the private system. And Calgary has a much longer wait time, significant longer wait time for cataract surgery that we see in Edmonton. So those things don't always jive. And I guess what we need to do is when we make policy, when we make financial decisions about how it is that we're going to invest our healthcare dollars, we have to think long term. And the policies that we create today will impact future generations down the road. So those are the kinds of things that we take into consideration when we're talking about competition.
Wonderful. Our next question comes from Laurie Schultz. The blood donation center in Lethbridge is closing and transitioning to the blood plasma clinic, which will open in December. Would you be able to comment how and if this falls into the government's plan?
Actually, that is a plan that was very much supported by Canadian Blood Services as a way forward to that opening of that plasma collection center. Is part of a larger strategy that Canadian Blood Services has to try and get off the dependency that we have on U.S. plasma derived products. This conversation is all about. It's not necessarily about. Um, the plasma being there or not being there. It's actually, the conversation is a business conversation where the collection of plasma has become such um, a market. It's called the liquid gold. Plasma is called the liquid gold because you can sell it to pharmaceutical companies that in turn make these products, plasma derived products that we buy back. And it has, like I said, it has expanded to a $1 billion industry. And so this is why private plasma collectors are so eager to get into the business of collecting plasma. But at the end of the day, we have a plasma collector, a blood collector, national collector, for a reason, and that was because it came out of the tainted blood scandal. And they have actually been tasked with ensuring that Canadians have enough blood supplies and enough plasma supplies so that we are able to get not only the fresh plasma transfusions, but also the medication that is derived from plasma. So it is a very good thing that that's happening in the Lethbridge area.
Okay, our next question comes from Laurie Schultz again. Will the long-term care disaster be a possible catalyst for this government to change course?
That's what we were hoping that we would see, except for the fact that now we're seeing a double down on the government's decision to continue to privatize seniors care. What in last week, Minister Sandra basically talked or introduced a new approach to building more seniors care facilities. And he indicated that the first part of this approach would be to involve opening a mere 1 month long bidding process to corporate and non-profit organizations who could identify underutilized spaces in existing buildings to become new publicly funded, privately delivered continuing care beds. As of now, the government is uncertain how many new beds this program will secure, or how many additional staff will be needed, or how much this will cost to the public. So if you have identified a place where you want to pay out of your own pocket to retrofit this facility and bring in, they mentioned the number of 14 to 18 seniors to live in this facility, you could apply to get funding to run a seniors care facility. So that's how low the bar has been set when it comes to this new approach. And then he also mentioned the fact that in the upcoming months, he will be putting out more information about ASLI 2.0. And ASLI is the Affordable Supported Living Initiative that has been used in this province to provide capital grants to corporations to build seniors facilities. We as taxpayers provide up to 50% of the capital cost to build them, but we don't own them. They do. And so if they ever want to get out of the business of providing seniors care, we have to buy these facilities back at market value. Then once they're built, we continue to pay them, and basically provide the operational funding for these facilities to run. And then seniors pay because they pay for their rent and they pay for their accommodation charges and anything else that's not covered by our continuing care system. So we don't see an end to this, and I'm hoping that people will get angry enough at this point that they will start demanding that the government actually go back on this, and actually take time to reevaluate and reimagine a better way to providing care. There's no way that we can go back to the normal way that we were doing things. We need to implement staff to patient ratios in seniors care facilities. We need to do a lot of work to make sure that seniors are never in this situation again. We need to learn from this pandemic, and what we're seeing right now is that this government is failing to do that, and it's failing miserably.
Our next question comes from Leona Jacobs. Perhaps not on an immediate topic, but there was a recent announcement re increased funding for palliative care, which the object of which the object of keeping patients in home longer, but at the same time the funding available to have palliative care doctors visit in home dissipated with the chaos around the funding for doctors. However, it should I should say, so how does this square for those folks at the end of life? I personally see this as a downloading onto unpaid, usually female, untrained caregivers. Do you care to comment?
Yeah, that was a very interesting announcement. And it was interesting mostly because of who this minister put in charge of doling out this $20 million. $1 million was given to the Alberta Palliative Association, Hospice and Palliative Care Association, to set up a grief line, and basically those types of support. So that, I mean, that is a good move. Um, then the other 50 million were 5 million, I believe, were given to Covenant Health, and the Covenant Health area, to look at palliative care. And then the other 14 million were um, MLA Williams is going to be tasked with, after supposedly meeting with stakeholders, tasked with allocating that money into our palliative care system. The concern that we have is that he's also the MLA who indicated that if we, in Alberta, if we can privatize liquor stores, then we can privatize education. And he was also the one that brought forward Bill 207, which wanted to give care providers conscientious right, which they already have afforded to them. But what that bill wanted to do was actually take away their ability to refer if they did not agree with the type of services, the legal services that people were seeking. And so that kind of puts the palliative care conversation into the forefront in terms of, is it a good move, or do we have, see, this is what happens when you don't trust the government to make good policy decisions. Because if you look at his background and where he's coming from and the angle that he's coming from, then is palliative care actually going to be strengthened to the point that it needs to be? Because it's such an important service, and it has been a service that has been underfunded for so long. It requires specialized caregivers, like you mentioned. It requires such gifted people that allow people to basically die with the dignity that anybody needs to die with, and with the care that they need to have, prior to their passing. So for us, it was a very odd selection as to who he put in charge, but what we're hoping is that we will at some point see what it is that they plan to do with palliative care, and if that's going to negatively impact access to services such as medical assistance in dying, and what it is that this government is trying to do in the background with this whole announcement that was made.
Okay. Our next question comes from Beth Mundell. Public home care workers neither got danger pay, which their private hired cohort government got, nor increased pay. In spite of rhetorics thanking them, no pay increase. Why?
This is very good. When it comes to continuing care, and again, home care is one of those areas that actually is covered under continuing care. Private and not-for-profit operators and contracted agencies received close to $200 million in COVID support money that was supposed to also go to give higher pay to the staff that were working and that have been working nonstop throughout this pandemic. But again, it just goes to show you that that our public system is not valued in the same manner that their friends are, I guess, that we have given them enough money for them to have, basically survived and provide the services that they're supposed to provide through this pandemic. Yet, throughout this pandemic, we heard all kinds of issues about the one site, where people were only supposed to be working in one site rule not being respected, or being kind of let go by Alberta Health Services because there wasn't enough staff. We didn't see a real actual movement that you would expect to see, given the amount of funding that these organizations received. And so I think in a lot of ways, what would have been a good thing would be to have actually done a review of the response by seniors care providers and how it is that they have allocated funding, and private home care providers as well, and be able to take a look at that information and assess exactly what it is that these providers are actually doing with our public money. Or was it just we put out a press release and we called it Christmas for private and not-for-profit seniors care provider, because that's what it turned out to be. This pandemic turned out to be for them.
Okay, the next question is also from Bev Mundell, but I think you've already answered it. It's very similar to the first question that was asked by Timothy. What do we say to people who say we've already got a private healthcare system, so what's the problem? Maybe we'll just keep this one brief.
It is a huge problem. Like I said before, we don't want to set a healthcare system or support a healthcare system that is not based on that is based on need and not ability to pay. Anytime that we get that response, it also has to come with a question as to, if you get sick, are you able to afford private healthcare?
Yeah. Leah, Kenneth Peterson, the COVID-19 pandemic has clearly exposed that public healthcare is faring much better than private. Arguably, more pandemics are on the way. So it seems important to keep our current system.
Very much so. I couldn't have said it better. I think that's the whole intent. If we don't learn anything from this pandemic, or if we learn anything from this pandemic, is that the healthcare system is what has saved so many lives here. We look across the world and just look at our neighbors next door and see what private healthcare looks like in a time of a pandemic. And I think we thank our lucky stars that we live in Canada. And and for that, I think we also need to have the responsibility of ensuring that we protect what we have and that we improve what we have, not just the status quo, but that we improve and expand our the solid foundation that we have within our public healthcare system, and find solutions that will improve access to surgeries, that will improve access to a better and reimagined seniors care system, home care system, and basically have a system that's, like I said before, based on need and not ability to pay.
Our next question comes from Ian Hurdle. Prior to COVID, Kalispell was doing as many Canadian joint replacements as Lethbridge. US costs are 5 to 10 times Canadian ones. Would it be better to employ locals and not lose forever funds from Alberta?
Sorry, which company was that?
I think it's Kalispell, which is a town in the United States. So prior to COVID, Kalispell was doing as many Canadian joint replacements as Lethbridge. US costs are 5 to 10 times Canadian ones. Would it be better to employ locals and not lose forever funds from Alberta?
For sure, locals in meaning our staff within our public system, and not necessarily opening it up to these private for-profit surgical facilities or non-hospital surgical facilities, because that's a problem. And I hope I'm getting your question right. When you're talking about these facilities that the government wants to set up, and that there have been all kinds of requests in getting these surgical facilities to sign up. Basically what happens is that these people are also working in our public system. So when they open up their own little clinic, they leave the public system, and we lose incredible amount of human resources. I mean, we only have enough anesthesiologists to go around. We only have enough surgeons to go around. And over the years, what we have done is actually put ourselves into a bigger hole in terms of making specialists become really specialists into some really tiny thing, and they don't necessarily do anything else. So there's all kinds of things that could actually be done in the public system to ensure that we do have local capacity, that we do hire our doctors, that basically the doctors that are working in the public system remain in the public system, and that we, look at what is bottlenecking these surgeries. Is it the fact that, that we have not enough operating rooms, that we don't have enough round-the-clock access to MRIs and diagnostic imaging in hospitals? There's all kinds of questions that need to be asked when it comes to determining how it is that we deal with wait times. But definitely finding solutions within the public system is what we need to do if we want a long-term solution. Bringing in private is very much a short-term Band-Aid solution that down the road will ultimately cost us more.
Okay, we have quite a few questions left. And so there's two questions that I'm going to read out because I think they touch on the same subject. The first is Laurie Schultz. Can you comment on virtual healthcare such as TELUS Babylon? And then Ian Hurdle, talking to physicians, they have been very unhappy with commercial push by TELUS of Babylon in 2 provinces. Maybe you could comment on both those questions.
Yeah, you know what? That's definitely something that we are currently very much interested in following up, is the role of third-party app developers that have somehow decided that they want to get into the healthcare industry. We need to have a little bit more information as to, I get the fact that people weren't able to go to the doctors during the pandemic, and that virtual health was necessary. However, we already had in place a virtual health platform within our public system that could have been supported more during this time of pandemic, but instead they chose to outsource it to TELUS, and TELUS stands to gain a lot of money in this new world of health that they've entered. So I think in a lot of ways we will have more to say about this in the upcoming months, because we are currently engaging in a study around virtual health, and with the Canadian Health Coalition members. So stay tuned if you want to hear a lot more about that platform.
Okay. Bart Phillips, the Ernest Young report recommended that certain surgeries, such as hernias and tubal obligations, be defunded. Could you comment on that as to whether the government will follow through on that?
We actually haven't heard anything as of yet, but like I said, these recommendations have slowly been trickling out. And Barb, I think, mentioned tubal ligation, hernia surgeries as not being I guess I describe it as not being, apart from not being medically complex or whatever, that could be done somewhere else. I don't know if the Minister of Health probably has never had a tubal ligation or that kind of surgery, because they're not simple surgeries, and hernia repairs are not simple surgeries either. So I think a lot of those things that will be coming up, that we will be seeing slowly trickle out, need to be brought to the forefront, because that's how governments have managed to delist services for a long time, is basically us not even being aware that all of a sudden these things are not covered, and that we are expected to pay out of pocket when we go and do these services, and it's been privatization by stealth that we have seen over the years, and the pattern continues. They bring it out, and then nobody talks about it, and we normalize the situation, and then until somebody's faced with not having or not being able to get these surgeries that were delisted, or services that are delisted, then it becomes a reality for us. So I think more than ever, we need to become really alert and share whatever information we get around some of these changes that are being made in the background.
Okay, our next question is from Mario, who is from the college studying journalism, and will be reporting this for the Lethbridge College. While the government will still pay for services received privately, do you believe this is only just a step closer to a fully fledged American style of healthcare system?
For sure, and like I've said before, I think it opens the door for those ones that are seeking to sell patients those little extras, because there's all kinds of things that happen when you turn doctors into entrepreneurs, when you turn the system or those corporations that are coming in to provide services into, or giving them the opportunity and the legal framework to be able to privatize. That's exactly what will happen, and this is not fear mongering. It's basically the logical steps into what it is that we're doing with the legislative changes and allowing this market entry to happen in Alberta. I think all Albertans should be quite upset about the fact that is happening during a time that all these changes, drastic changes to our healthcare system, are happening under the cloud of a pandemic, when we're all worried about work, when we're worried about the health of our loved ones, that they've decided to kind of push forward. And so I say shame on them and for doing this, and it's exactly what will happen, Mario.
Okay, we have 2 more questions left. Just one just came in, so 3 more questions left, but we've passed our time. Are you okay to stay on a little bit longer and answer the last couple of questions, Sandra? Okay.
For sure, yes.
So
yes.
The next question comes from Beth Mundo. With excellent doctors leaving the province and corporate hiring of docs on the horizon, will we be getting the lower qualified docs or those from the bottom half of the class?
You know, if you look at my last slide, there were over 400 doctors are leaving the province of Alberta. If you want to actually keep tabs on that, I suggest that you go to Kim Seaver's page. He has a tracker of how many doctors are leaving. The AMA has indicated at over 400. Unfortunately, what we're going to see as a result of this very public negotiations is a loss of a lot of doctors, and we're already seeing it. In Medicine Hat, for example, there is a very fine and well-known obstetrics clinic that is losing 8 doctors, and that potentially leaves that community, you know, very hard-pressed to have obstetrical services for women. So this is not a joke. Like, I don't understand why this government has taken that nonchalant kind of attitude to a reality that we will be faced with when it comes to losing so many doctors that have worked in their communities for so long. So who they hire, I have no idea what their plan is, or even if they have a plan as to who they think they can bring in, and how it is that they're going to be, you know, accrediting these doctors. I know that through legislation with red tape reduction ministry, that we are seeing, you know, a lifting of requirements at some points, or making it easier for people to get accredited here for their professions. So it will remain to be seen who will be taking over these over 400 doctors that are leaving, and seeing what kind of quality of care Albertans will receive as a result. My hope is that they're not that Machiavellian, that they will just hire anybody, and that they will be responsible for those that they hire.
Okay. Ian Huddle, AHS hospitals seem to have copied private firms by designating workers as casual, even if working full-time, to avoid paying benefits, including nursing, labs, etc. I guess that's more a comment than a question. And Leona Jacobs, for clarification, how do these changes square with Canadian Health Act?
You know, we have done a bit of a legal opinion that we will be exploring a little bit more around Bill 30. This government is a smart government in that they were very much aware of the limitations of the Canada Health Act. However, what needs to happen, what we need to look is to the legalities around the definition in Bill 30 of who persons are. There's all kinds of legalese and languages that are you know, definitely need to be looked into more. But on the surface, until we actually start seeing user fees or blatant infractions of the Canada Health Act, that they have managed to word the bills, and that they have managed to actually create a narrative that in everyday language doesn't seem to violate the Canada Health Act. But again, that's above you know, our knowledge base, so we will be seeking further legal opinions on what it is that we can do from that level, and whether or not we need to be looking at some of the implications that it actually has with the Canada Health Act. So we have written a letter to the Minister of Health, the Federal Minister of Health, and we will see from there as well. You know, keep in touch with us, and we will definitely share more information around that issue. I had in my last slide, there's a slide for Friends of Medicare tracker. If you're interested in keeping abreast of some of the things that this government is doing, and some of the changes that sometimes may or may not be public, please go into our website, www.friendsofmedicare.org, and you can look for the tracker under the portion that says blog. And that's a great way of keeping updated on what it is that we're doing. And like I said, some of these areas that I haven't been able to give you more clarity on, like virtual health and this impact on the Canada Health Act, will be coming. More information will be forthcoming.
Great. We've got some thank yous from Devon Hargraves, from Mario Cabardillo. Laurie Schultz, thank you very much for an informative, albeit sobering presentation. Barb Phillips, excellent presentation. All this is very scary and needs to be taken very seriously by Albertans. So thank you very much for your presentation today, Sandra, and joining us. Do you have some parting words before we end the live stream?
No, thank you again for listening to me for this length of time. I just want to encourage you to get involved right now it's not just Friends of Medicare bringing attention to this, but there's other organizations as well. But get involved. This is a time where we need to all stand up. Our way of doing actions is no longer the same that we had before, because otherwise we would have been out in mass on protests and rallies against Bill 30, but we can't. So we have to find new and innovative ways of taking action. And I hope, and I invite all of you to take part in some of the actions that we will be having, and certainly keep informed, because that's the only way that we can keep this government accountable, and basically let them know that we are watching, that people are aware that this is their plan, and that we will not let them get away with it. Profit has no place in healthcare.
Wonderful. Thank you. And thank you, everybody, for joining us. Bye-bye.
Thank you.